Hey everyone, so this is the part 4 of my story with an autoimmune condition. So 2 decades, 20 years of living with autoimmunity. I just have to tell you, I tried just about every holistic tactic offered as well as to study them extensively. I sought out the best of the best to study with the best, but I was more interested in how I can turn my life around. Here's the thing, you guys. I was a vain young woman. It meant everything to me to look the part, to dress the part, and to be the smartest I can be. I was ambitious, goal-oriented, and to have an autoimmune condition spiraled me out of my control. It sucked the life out of me. It really destroyed my confidence and my identity. And so it really was the testing of the times. So I tried traditional Chinese medicine, holistic health like kinesiology, anything aromatherapy. I did acupuncture, I did herbal medicine, and finally I found functional medicine. I got certified, and again, I studied just about every discipline there was. I got short-term effects from just about everything that I did try. That's the truth. However, there was no long-term solutions to this predicament that I had because, again, it was giving me, unless I drink the Kool-Aid, so to speak, or really been fully committed to being in that respective camp, it was so easy to get so stuck and get frustrated at the limited effects that I was getting or the results that I was getting. So there needs to be an yin and yang to everything, right? So when I talk about the yin, I found that when I went to functional medicine, it was like the holy grail in my eyes. Functional medicine and anti-aging medicine are the two that I explored. And I found the Institute of Functional Medicine because I felt it was the most reputable. I didn't want any BS, but I was looking for something very scientific and research-based, something that was so credible to really get my mind around and something that I can respect and really apply in my life, as well as I was seeking to be an expert at it because I wanted to make a career out of being healthy for myself. What I found when I first sought out the functional medicine doctor was that they did overextensive labs that weren't typically done in a conventional medical setting, which was fine, but it was expensive. But my question was, how was that going to be applied? Because they still came with the premise, all these doctors don't know autoimmunity because it has so many different facets and faces that it's impossible for them to tell you how it presents for you. And no matter how many tests that they do, it's not end-all, be-all diagnostic, as well as they don't know how to apply the thing that they're testing. So I realized, what are the things, the diagnostic principles that they apply? And how sensible is it to get lost in the science of biochemical reactions when there's so many variables playing into the effects of biochemical imbalances that we are subject to? Everything from hormones to enzymes to nutrient absorption, leaky gut, to microbiome, to genetic mutations. There's just too much catch-all. And then we had to kind of consider our reactivity and responses to the immunologically taxing components and toxicities. So I found the best protocol would be to really look at the host and look at them as a whole being. Everybody's individualistic, but how about if we create an internal healthcare system? We've got the immune system, we've got the endocrine system, we've got the GI system, neurological system, we've got all the systems within. How about if we create an internal healthcare system? And how about if I create a way to empower each patient to trigger and reset their healthcare internal system? Is what this is. So let me tell you about my experience in the last year and how I came to this conclusion. So I've had 3 serious relapses or flares in lupus, and it all involved my kidneys. It was inflamed kidneys called nephritis. and it can potentially cause severe damage to the kidney, which is a vital organ for detox and everything else. And it's very vital. If you lose it, you might go into dialysis. In fact, my nephrologist always thought that was always an option because my protein levels are so high, my antibody levels were so high. He didn't know what he didn't know. There was this mysterious lupus driving this pathology. He was treating the pathology with very chemically altering, like immunosuppressive agents that are very toxic to my system. So I didn't want that because in my head, it was 3 strikes and you're out. I already had 3 flares and I've had 2 successful pregnancies. I have my 2 boys. I've got everything to live for. So all I want is to be as strong as possible. Last year, I had a little bit of a traumatic experience out of nothing. I've always felt something. I've always tried to feel good about myself, but I didn't really understand the underlying issues. There's this concept of the inner child, psychological therapy. I thought that was overindulgence. And I have a sibling, I have a twin sister and 2 brothers. And my brother sought out psychotherapy, as did my sister. And I didn't know why we were all struggling. But I too had moments of weaknesses, moments of feeling bad. The way I addressed it is type A. Don't waste time. Go do the next best thing. So I was always about being productive. All at the same time, I didn't give enough time and the due diligence and the self-care I needed to fix what was going on internally. I had a lot of trauma and hurts in my mind that I had to resolve in my head because whatever those thoughts and feelings it was creating for me, the habitual thought patterns that were looping so much so that it was altering my biochemistry, I can assure you that's what got me sick last year. So I had a little bit of falling out with my mom over something so simple, but it was a repeated offense. So when, mother-daughter relationships, those are the most loving, yet it can be very toxic. She has her viewpoints, I have mine. We're all egotistical. We're going to protect and be defensive for us. And so we all want just to be validated. It wasn't until I explored my inner child and inner hurts and all the traumas and revealed them to me by studying me and really thinking the thought processes that I realized I was butting head to head with my mom all the time trying to get validation. And I kept falling into this emotional immaturity as I was taught by the coach named Abreu Castillo. She really enlightened what I was going through because I was struggling so much in my parenting ability, being a daughter, being a friend, being a business owner. I was just really struggling. But the struggle with my mom was taking me to a point of no return to where I was really getting sick. I got so sick that I had no white blood count. I thought it was just a flu, and I had some fevers that come on with a clear malar rash. Went to the rheumatologist, my rheumatologist at the time, and he just dismissed it and gave me a Z-Pack, like a tapering dose of prednisone for a week to get rid of the rash. And if you know anything about me, if you can see my disease, Connie's gonna have a problem. If you can't see it, I can be like a tough cookie. But it was so apparent I couldn't go to work. And no matter how much foundation I applied, everybody can see how red and malard I was. And so I went to my rheumatologist, I took the corticosteroids. It kind of calmed down for a little bit, but it would come back. The fever would spike. I mean, this pattern went on for about a month. And it's gotten to a point where I had to talk to my rheumatologist, and he said if it doesn't get any better, my fever was hiking up at 102 to 104, no matter what I did. After a month, that's not okay. And I felt so crappy. And I thought it was just one of those things, but my work life was so busy at the time that I didn't have time to get sick, but I was getting sick. So it got to a point where I had to call my affairs and then admit myself to the hospital. I went to the hospital and I thought they were just gonna tell me, oh, you're gonna be okay, give me some strong medications and go home. And you know me, I don't like medications, but I was to that point where I needed something. They found my neutrophils and white blood count to be next to 0. They suspected something really bad. They suspected that I had sepsis because my fever was high And then they needed to do some culturing of my blood to see what kind of bacteria I had. All that to say, I was admitted and the bacteria cultures came back and I had blood infection in my staph infection in my blood. And so I needed to be treated on antibiotics. Neutrophils would not rise, white blood count would not rise with the antibiotics because the infectious disease doctor said if I get the right antibiotics that worked for me, my immune system should boot up. It wasn't booting up. They had to take my bone marrow biopsy to rule out leukemia at this point, aplastic anemia, both of which could be very, very life-altering, worse than lupus. But at that point, I was so sick, I had to get my affairs in order. My neutrophils didn't look back. It didn't look like I was going to bounce back. It was a Wednesday night I was admitted. By Friday, we knew nothing. Going into the weekend, my rheumatologist, the hospital one, not the one, my rheumatologist outside of the hospital, but the hospitalist rheumatologist came to me and said, hey, I looked at this specific research, you're put on Plaquenil, and I was on Plaquenil. And my rheumatologist was always kind of pushing for the therapeutic dose. And so I reluctantly got on it because the whole idea was to keep me in remission after 3 relapses, and I would not have it any other way. I could not afford another relapse or a flare involving my kidneys. I knew that much. So I got on the Plaquenil probably about 3 months before, and through the VISE testing, they can measure the hydroquinone therapeutic levels. It was always substandard, so I was accused of not being compliant with my medication. All that to say, this rheumatologist comes to me in 0.1% of the population. I forget if it was 0.1 or 1% of the population. They have a reactivity to completely shut down the white blood count or have neutropenia or cause neutropenia. So he said, that's easy enough. Let's get rid of it and see what happens. Sure enough, after we stopped the Plaquenil, my numbers started to go up. To this day, I don't know if it was the Plaquenil or the 5th antibiotics that started to work that allowed my white count to go up. But 10 days in the hospital, I was not getting any better. And so it got to a point where on the last day, they needed to give me a boost of blood transfusion to make sure that I was able to be discharged because I was still dangerously low in neutropenia. But what's more was they were really scared that I would be back in the hospital with the infection again. So they were reluctant to discharge me, but they did. And from that point on, I was seen by the infectious disease doctors with the port for antibiotics where I had to inject for probably about 6 weeks. All that to say, we did the final labs when I went to go see the rheumatologist. My rheumatologist wanted to put me on Benlysta to keep me in remission, but I held up my hand, I asked questions, and I pleaded with him to say, my immune system has been completely zapped from this experience, and with the antibiotics, I would like a chance for me to build up my health and my immune system using the holistic paths to boost me up. And I asked him to give me a month, and then he would check my labs every 4 weeks, they're on out. And every time he said, okay, I'll give you a month. And after a month, all my white counts and neutrophils started to come back normal. And all my lupus serology has been negative since June of last year. I was in the hospital in May, so it was never lupus driven. To now, I'm still lupus absent, right? The ANA levels were so down. VISE testing, I was indeterminate for lupus, but we're still not able to say lupus is cured. It's just supposed to be in remission. Whatever the medical system wants to place, that's fine. But what I believe is this concept of psychosomatic stress and trauma, because I tend to have a type A personality. Back in grad school when I was admitted or when I was diagnosed with lupus, I clearly remember going days without sleep in my efforts to go get good grades. And to me, I needed 8 straight A's. Everything else, like, it just didn't matter. You know, in grad school, all you have to do is pass. But to me, grades mattered. And so I would drive myself mad and sick, and I wouldn't really eat, and I wouldn't sleep. And I was vegan, so I was probably very malnourished. But through that time, I was really, really hiking up my stress levels. And then I went snowboarding. Snowboarding, I told you about that story where I was bumped and hit, and there was a lot of trauma physically. But then also there's this psychosomatic stress. But this last year, but that was when I was diagnosed, right? I had a lot of immunological symptoms. This is the same thing, is I had a lot of immunological symptoms, but it had nothing to do with lupus. It had everything to do with what I was creating for myself through my emotions and all the biochemistry it was creating in the way of to create havoc, wreak havoc in my endocrine system, the stress hormones and immunological systems. It was really altering everything to a point me as a host was not a very good candidate for anything. So my fight with my mom really brought up a lot of my history, the things that I never questioned about what happened when I was 7 years old, being almost orphaned in Korea, and then living a life and being absent with my parents, like complete orphanage. So I don't remember those times. And I never really talked to anybody about it. It was just like a repressed memory. We came to the States, and so I think I always had a chip on my shoulder because English is my second language. And so for a type A person like me, I always wanted to speak eloquently. I didn't like looking stupid, and I felt stupid. I came here when I was 4th going on 5th grade. And so if you don't speak the language, it's sort of like a lot of the educations, a lot of the pivotal like books that you would read in 7th and beyond, all that's foggy memory. All the lyrics that my friends used to like grow up with of songs and such, it had no meaning because I was so busy just memorizing the words of a song that I still remember. It's like the meanings come second. So the processing is a little bit different for me. So I've always been really highly stressed about that. But imagine to go from orphan to come to a new country, adapting to this new environment, and then nobody really asking what you think, what you taught, or what you think or what you feel, and nobody really getting or being sensitive to any of that. We're just told to just shake it off, repress it, and life moves on. There's better things to worry about, right? But what about if I told you those are the things that you really need to nurture and understand to be able to move through so you're not stuck in the past of that emotional immaturity? Because everybody has the experience of having upheavals at some point in their lives where something triggers you and you go right spiraling down into being so egotistical, defensive. I see it in other people. We can all judge others. But we all have those moments too. And so when we heal and are open and really offer up this opportunity to say, oh my gosh, these things really happened to me, and really having conversations with yourselves without judgment about that experience is going to be the key thing to develop a new relationship with yourself. Because here's the thing, I avoided being with myself for so long, and I just chose to be busy doing the productive things rather than loving on me, having good conversations, understanding me and honoring and respecting and loving me in ways I needed. And so how am I going to love my children and give them what they need if I don't even do that for myself? So here's what I come to is I realize we need to have number one relationship that we need to take care of is with ourselves. Only then can we project straightforward ways to create great relationships with others. Because if we have dysfunctional patterns and relationships with ourselves, that's more of what we're going to create. We're going to be with those mates who validate the inadequacies and then the incompetence that we feel all the time. Our partner is going to be doing that. Like, just really be validating those weaknesses that we hold dear, unless we know who we are and really do the internal work. And that's what I call the self-healing journey, the alkaline method. So I really want you guys to really understand how important it is to do the inner work so you can apply the tactics to boost your immune system and have breakthrough healing processes. But this is what I find, whether you're looking at other functional medicine, holistic practitioners, they're all about the tactics. Whatever is the fad, the new diet, the new supplements, and there's everything to validate exactly where they stand. There's so many camps, but a confused mind doesn't want to do anything. We get overwhelmed, we do nothing. So how about if I offer up to you, where you work on you utilizing the alkaline method to work on you. And these are 6 pillars, essential pillars that you need to work on yourself, to your inner healing, so you can create your own inner healthcare system. So number 1 is really being anchored in who you are. Know where you are right now without judgment. And that's only done with self-exploration and really jotting down what I call brain dumping every morning to know what thoughts you're having every single day. Because left in your head, it's going to really be recreating, because this is a very efficient system. It's the most efficient system on the planet is your brain. So thought download through anchoring. Anchoring is understanding where you are and really understanding where your roots come from and why you are what you are. And then once you understand that, get aligned with who you want to be and really get clear about the love you have for yourself and understanding yourself and honoring yourself and having regard for yourself, and then aligning yourself for the ultimate goal of the healing journey, right? And then really getting to the core truth of who you are and really having self-love around that. That's the first 3 layers of the alkaline method. It's all about the inner work. And only then, once you know who you are, you're anchored, you're aligned, and core truth of who you are, so much so that you're in full alignment with your soul, then and only then you can experience the bad and the good, the polarity that life throws at you. We've got the yin to every yang. We've got to experience sadness to experience the happiness and joy. We've got to experience the sickness to appreciate the health. So when you're really foundationally strong, polarity just comes. You come to expect the obstacles. Because here's the thing. Autoimmunity is here for the ride with you. It's like a date you take on. You don't want to complain to your date. You want to embrace your date and love it and hold on to it and be a partner to it. Use it as a catalyst to be the healthiest version of you, right? And that's the part. If it has a flare, you guys get bickering and in a fight and at crossroads, you commit to resolving that any way you can. That's the polarity part. That's the 4th pillar. 5th pillar is pranayama, breathing into it and accepting and being present for what it is right now you're experiencing. And learn to really digest the emotions and really digest the food that you take in for your physical body, for your mind, as well as your emotions, and really feeling what you should be feeling, negative or positive. We need both to have a full-on life experience through the pranayama. That's the 5th pillar, it's the breath. And then the final pillar is all about the balance. Sometimes we're going to need the sick care system, the doctors, understanding their role in our lives in autoimmunity, and then understanding what our role is and finding a balance. What kind of relationships do you want to have with your children, with your lover, with your family, with your mom, whatever that is, and find that balance by creating boundaries, healthy boundaries. But you need to do that from the place of knowing who you are. So the first 3 pillars are fundamental bases for you to stand so that your healing can begin. And only then can you begin your true healing journey. Because here's the thing, I appear to you today. I know that resilience in your mindset really requires you to be really super clear and focused on who you are first and foremost, and know what disease you have and accept it and be empowered by it and change your paradigm, shifting your thoughts in such a way to have it a productive effect in your life as opposed to a negative effect. How I can tell you this is I've experienced both. I let lupus really deteriorate me and really sabotage everything. It wasn't until I did the hard work of the paradigm or the alkaline method, the first 3 pillars of working on me, to understand how I was going to live with this circumstance and think and feel and generating the thoughts and then the emotions that I need to take the necessary actions and to rise above the second external piece of the alkaline method, which is finding the polarity, finding the breath and being present, and then also balancing. I know everything sounds really complicated, but it's really not. Healing really is an inside job. You have to have the choice to do that. And healthcare system is within you, it's within me, it's in everybody. And that's the great message that I want to spread through our work. We call it the Tribe of Autoimmune Health Rebels. We have a private Facebook group that we created. It's going to be very interactive. I really want to spread the word. And I want to work with those of you who have been around the block working with every popular name and buying every book out there on holistic medicine, functional medicine, anti-aging medicine, any nutritional advice, any diets that you've tried. I'd like you to work with me and consider this comprehensive plan where, you know what, ultimately you're going to need the mindset piece, the deep work of knowing you and being coached through it. You're going to need accountability to know how to incorporate everything. You're going to need to incorporate movement, the nutritional piece, nutrition for your mind, body, and soul, as well as movement, healthy movements to retain mobility in all the joints of your body, because it's the largest organ in our body that helps us to be clear in all the things we talked about, whether it be mindset, emotions, or even the foods that we eat. We need movement to be able to properly metabolize. So everything is a comprehensive plan. So if you've kind of, bit off pieces of each program and you've gotten some progress in your health but not a full gamut in a way that really makes sense for you, then please join our tribe so you can get clear on your path to your self-healing journey. Thank you so much for watching, and I hope to see you guys in the group.